So good afternoon, everyone. My name is Dr. Eric Toring. I'm the Senior Vice President for the American College of Veterinary Preventive Medicine, and I'd like to welcome you to the webinar today. Today's webinar is sponsored by the American College of Veterinary Preventive Medicine, the American Association of Food Safety and Public Health Veterinarians, the National Association of Federal Veterinarians, the National Association of State Public Health Veterinarians, and finally the U.S. Animal Health Association. It is my pleasure to welcome our two speakers today. Dr. Neil Bizeau is a food safety veterinarian working in Hawaii at the Wildlife Human Interface. He completed his DVM and MPH at Iowa State University and the University of Iowa in 2021. Neil currently serves as president-elect of the National Association of Federal Veterinarians, where he and others work across multiple societal sectors to address veterinary public health workforce issues. Neil was founding president of the International Student One Health Alliance, in which he built One Health capacity with youth worldwide. He continues global One Health related work in the American Veterinary Medical Association's Committee on International Veterinary Affairs. His scholarship focuses on antimicrobial resistance, gender equity, and One Health training pipelines, and he typically coordinates teams on international stakeholders for these efforts. Joining Neil today is Dr. Robin Alders. Dr. Alders is an honorary professor at the Australian National University and Tufts University and leads the OFFLU Socioeconomic Working Group. She helped develop the FAO World Organization for Animal Health's revised global strategy for the prevention and control of HPAI. For over 30 years, Dr. Alders has collaborated with family and smallholder poultry farmers in sub-Saharan Africa, South and Southeast Asia, and Oceania. Her work as a veterinarian researcher and colleague focuses on sustainable infectious disease control in family poultry to support food and nutrition security, income generation, wildlife conservation, and public health. Her interests include food and nutrition systems, One Health, gender equity, inclusive policies, and science communication. Dr. Alders has over 200 publications and has received multiple awards, including the Kesteven Medal, Officer of the Order of Australia, and the Veterinary Practitioners Board of New South Wales Centenary Award and Medal for leadership in veterinary epidemiology and One Health. Please welcome Dr. Bizeau and Alders.
Thank you for that introduction, Dr. Toring. Yes, today we're going to be talking about gender, veterinary public health, and One Health. And just to be absolutely sure, can everybody hear me okay at this point in time? Either be a thumbs up.
I'm giving you a thumbs up, Neil. I can hear you fine.
Excellent. Thank you. All right. So these are the basic topics that we're going to run through just to let everyone know beforehand. We're going to be going through just a kind of a whirlwind tour of One Health, gender, veterinary public health, and how all those intersect in ways that perhaps you might not have thought of before. One quick note for myself. I am giving this talk in my personal capacity, and though I am an employee of the USDA, I am not giving this talk in any way that is affiliated with them or their points of view or those of the U.S. federal government. With that out of the way, let's get into an introduction to women in veterinary medicine and the demographic changes that we've seen with that. So, as people here might be familiar with, veterinary medicine is what you call a feminized field. That's a technical term. I know some people just at face value don't always take that very well, but that's what sort of the experts call it, basically. Over the past, what we can measure over the past century or so, there's been this really drastic increase in veterinarians that are women, basically across the entire globe or wherever we can find the data on it. This is essentially myself and some others trying to take a first stab at getting those global data points. You can see particularly strongly in North America or the Americas region in general, but a lot of that data is coming from the US and Canada, as well as Europe. You have this very precipitous rise in veterinary professionals, specifically who are women. That's looking like it's stabilizing at regional levels in like North America and Europe, for example. at around 80 to 90%, or like it will stabilize at around that point. But that remains to be seen. A lot of the other data points that we have here look a little bit kind of like up and down and up and down, and that's just because the data from different parts of the world is a little bit more scarce, a little bit more sparse. But the trends, nonetheless, are evident in some regions. When we look at this with specifically student populations, that allows us to kind of peer into the future a little bit. If people are familiar with the thought experiment of the ship of Theseus, whereby you have a boat that is rebuilt by every single part, and you ask if it's still the same boat. You can think of a student population like a ship of Theseus that is essentially about 1/10 the size of the professional population and is sort of rebuilt or turned over in its constituent parts about 10 times as fast, depending on what exactly the training system is for where you are. So with that allows us to see what our populations might look like far, far into the future by looking at our inflow into the veterinary professional population. And with that, you can see that in the European and Americas regions, and these are WOA regions, by the way, World Organization for Animal Health, though their regionalizations are fairly consistent with those of other sort of intergovernmental organizations. You can see that this is also leveling off at around 80 to 90% in those areas, and the data looks a little bit kind of askew just because of the sparseness, either via time or place in other regions as well. Probably the highest percentage of women that you find anywhere is Finland, and I think even in their professional populations, they have about 93% of veterinary practitioners who are women at this point in time, and that's been the case in their student populations for about the past 2 to 3 decades. So that's sort of the upper bar, I suppose you can say, of where we're at with that demographic shift. But you can see the sort of sigmoidal trend here, particularly clearly in the student populations, and that kind of gives us a sign of things to come as far as what a plausible sort of upper limit might be of the demographic composition of veterinary medicine into the future. There's very continually this anecdotal, at least, correlation between the rise of women in the profession and the rise of small animal practice in the profession. There's not a like that's sort of discussed in sort of popular press articles and the like. There's not a whole lot of data that I've been able to find, at least, that's really suggestive of the connection between that, though that doesn't mean that it doesn't exist. I'm just not sure how much of a robust investigation there's been done at like a really sort of global level at this point. But that also kind of brings up different issues regarding global north, global south divides, and places that essentially have more money to have pets and have advanced care for them, whereas in more toward disparate parts of the world, or LMICs, you would say, low and middle income countries, pet ownership is not as high, or at a bare minimum, they're not able to sort of treat for their pets as they would like a family member, for example. And when we're looking into the public health field as well, because we're also discussing veterinary public health and One Health. The One Health itself is not a sort of hugely institutionalized field in the way that public health or veterinary medicine is, at least at this point in time. All of its sort of constituent parts, or at least most of them, inclusive of public health, are also what you consider to be feminized fields. And there's some research that myself and some other folks are coming out with that is suggestive of One Health considered as a singular field to be very much the same. We'll discuss this a little bit more later, but within the context of where we can actually measure this, or where the analyses have been conducted, pay equity is a big issue among many other fields between men and women. Veterinary medicine is the same, and we'll have some charts and figures on that sort of forthcoming. One thing that we also want to get out of the way really quickly is the difference between sex and gender. Um, and actually, Robin, were you going to take this slide? I don't want to steal your thunder. And I think your
Sorry,
mic might be
Neil.
off.
Yes, yeah, sorry, you can speak to this. I'll follow up with later slides. Sorry about that.
Okay. All good. Thank you. So sex and gender are certainly related concepts, but they are not equivalent. Sex is essentially what you would call a biological construct, and it's sort of the summed components of a variety of biological, cellular, and anatomic features. And this is often, at least in animals, mammals, looked at as a male versus female thing that you can sort of think of on the level of like what kind of gametes are being contributed to sexual reproduction. However, genetic determination is not sort of a binary thing, and there is a spectrum basically that can be dependent on like how many of whatever types of sex hormone receptors are being expressed on the cell or on the nucleus or whatever. And it's not simple. Rarely with these sorts of matters are we afforded the luxury of simplicity. Probably even more so with that is gender being a sociological construct or sociocultural construct that basically pertains to how people interact with one another and perceive one another to be. You would typically discuss this in terms of what are social norms or matters of identity or claimed identity. And in many cultures, though certainly not all of them, gender in humans is thought of on a masculine to feminine spectrum, but there are certainly, places that don't sort of stick to that model. Again, rarely do we have the sort of luxury of simplicity with these sorts of things. And I think this is where you take over, Robin.
Thanks very much, Neil, and good morning to you all from Australia. Hopefully you can hear me, and hopefully you're going to understand my accent. How is my accent for you? I also should say that Neil's kindly going to share the slides. I'm joining you via satellite internet, and there's an East Coast low on its way. So if I disappear, Neil will continue for me. So I can see a few thumbs up, meaning at least some of you are understanding me. So that's great. Next slide, please. So as Neil has explained, when we talk about gender, we understand that gender influences our place in the world and how we experience it. When we think about occupational risks, it can be difficult to know whether gender is a cause or an effect of what we're seeing. And part of the challenge here is that really we haven't done a very good job of disaggregating a lot of data that our profession works with is still not sufficiently gender disaggregated. That's true of the veterinarians within our profession. It's also true of the people with whom we work, animal owners, carers. As Neil mentioned, we're seeing that at least in high-income countries, there's a significant number of women working in high-income countries, and you'll all know that it's been a challenge in many places to have women seen as veterinarians, quality veterinarians working in large animal settings. But I'll have to say that is changing. Certainly in Australia, we're seeing increasing numbers of women getting involved in large animal practices. And for those of you who have done it, you'll know that on occasions, some of our features actually mean that we can do a better job, particularly in calvings, I would have to say. Okay, on to a much more serious issue. When we do a breakdown looking at men and women veterinarians, we're very much aware of the issue of suicide in our profession. I know it's a problem in the US. It's certainly a problem here in Australia that we're tackling. But when we disaggregate that data by gender, we see that for male veterinarians, they are twice as likely as the general population to die by suicide, which is totally unacceptable. When it comes to women, the data in the US suggests that women are 4 times more likely, female veterinarians are 4 times more likely to die by suicide. A statistic that is totally unacceptable, reflects badly on the situation in which our profession finds itself. And that, as Neil mentioned, this term feminization is seen within the public health workforce. Even I'd have to say within academia in Australia, this term is used. And what we see is that often feminized workforces are those associated with lower pay, possibly lower recognition, but often linked with roles where we're serving the community, serving animals. Next slide, please. In terms of behavioural risk, once again, insufficient data, insufficient research for us to be clearly able to say what's going on. It is an area that needs much more attention. Certainly, as I mentioned, at least in Australia, we're seeing more women working in rural areas, being involved with mixed practice or large animal practice, but it can be harder. It can be a challenge. When you arrive on a farm, you open the door, you walk out, you see the farmer's face drop. But if you do a good job, that's the most important thing. And often they'll be the first ones to call you back, because what every farmer likes is a successful outcome after a visit. And as I mentioned, caring services, be it nursing, working in nursing homes, public health, veterinarian, often now feminized occupations that are associated with various challenges. Next slide, please. Intersectionality is a term that's been introduced, and it's a really useful term. What it does is try to understand what's contributing to the situation in which individuals find themselves. So just talking about being male, being female is only part of the story. That's linked to your background. It's linked to your culture in which you've been raised, that's effect on you. It's linked to factors such as your wealth status, your race. It can also be the situation in which you have been raised. So this term is really important, and what it does is just indicate that as individuals, we're multidimensionals with multi-factors that influence our experience in life. And what I would say from my very brief time working in the US at the Tufts Vet School, that they were certainly working to try and increase the range and the different backgrounds of people who were becoming vets, who felt able to become vets. And that remains an ongoing challenge in many settings. Next slide, please. If we're going to think about gender gaps in relation to One Health research policy and implementation, I would like to give my experience of One Health. It's a beautiful term, the idea that human, animal, environmental, plant health, the health of soils, air quality, they're all related. However, I'm sure many of you are aware that the term One Health was introduced in the early 2000s. It was generally used commonly in relation to the outbreak of bird flu, of high pathogenicity avian influenza H5N1, and the focus was on the zoonotic aspect. So the focus on disease in animals causing a threat to humans. And in my experience, often the people who used the term, the people who were successful with getting funding, were those that were doing virology. So they were the virus hunters. They often focused on the pathogen, and in many cases, these were molecular virologists. Next slide, please. And so this history is related to what we're seeing with unequal representation within each of the professions that are involved with One Health. That certainly in certain terms, in most countries, the situation for women has improved. We're now able to get jobs. In Australia, if we get married, we no longer have to give up our job as women did up until the 1950s. So some things are getting better. However, often the roles that women take still remain undervalued, and the range of skills that women will bring to these jobs are often undervalued. The one thing that I would like to mention, and I'm learning more about as I've returned to Australia, is that the perceptions of the value and the roles of women, men, and those of other genders, it hasn't always been the same. And in Indigenous communities in Australia, and as I've mentioned here in this slide, in Indigenous communities in the eastern woodland of the North America, the role and the value of women and men was much more balanced. It wasn't seen as one was better than the other. They were just slightly different, but equally important to the functioning and the survival of those communities. There's something about the Western approach. Was it the Romans, who just made women property, and that changed our role. When we get married, when we receive that engagement ring, for some people, traditionally that was buying our reproductive rights, so therefore we became property. In my mother's case, in her as soon as she got married, she even lost her first name. Instead of being Alice, she became Mrs. Ronald Alders. So a lot has changed in some ways. In some ways, we still have quite a way to go, but it's great to have a look around and look at the ways different societies have functioned, and to be able to think about how we would like to see our societies function as we move forward. Next slide, please.
Was this was this you or me?
Oh, well, you can do this if you want. Your choice. If you'd like to talk to this, go right ahead.
Oh, basically all I have to say is that this is just a graphical representation, circa 2022, breaking down in that snapshot of time, that graph I showed you all about, where we're at with veterinary. I have the Zoom thing in my way. Whether does that say students or professionals at the top of the screen?
That's professionals. The
Oh,
one after this is students.
okay, thank you. So yeah, this is where we're at with veterinary professionals in terms of gendered breakdown. The basically blue is more women than men, and red is more men than women. And you can see certainly among these lower middle income countries, you have more men than women, and there's a couple potential kind of socioeconomic as well as gender index correlates of this. But it's a little bit hard to see what the exact drivers are right now. But basically, the wealth of a country, with some exceptions from notably like East Asia, that seems to be a significant correlate of just women's empowerment, and also the composition of women in veterinary medicine specifically.
So go on to your next one, which is Oh, gotcha. These are all your graphs, Neil. Please speak to it.
Okay, gotcha. And this is from a study that myself and some friends published last year, and this is looking at specifically the leadership within academia, just because academia was one of the easiest places to consistently pin down where and who those leaders were. And we can see that this is a very similar color ramp to the previous graphic there, with red being more men than women, and completely red means completely men, and blue is more women than men. And basically, you can see from this that you have a even further kind of skew to this, and we don't have this graph here in the slide set, but when you're looking at just deans, like this picture right here is looking at the entire dean suite and their equivalents, so associate deans and the like. When you're looking at just deans, it's even more so skewed than this in terms of male composition, or being composed of men rather. This is about 60. This is about 2/3 men within the dean suite at a global level, and it's about 3/4 men when looking at just the deans. That being said, this is looking at this would be a whole nother webinar basically, but this is probably looking at about half of the vet schools that exist, just because the lists that were used were essentially not entirely inclusive of all the veterinary schools. And given that those that were not included were from these places that had lower development indices, lower socioeconomic indices or metrics, it's possible that things would be even more skewed towards men than what we were able to find.
Okay, so in terms of gender gaps, what I'm about to say won't be come as a surprise to any of you, is that across the world, we often find that there is unequal compensation and recognition in the vet field, in health fields in general, and across society. When we look at the breakdown of how men and women spend their working day, find that it's common that women perform tasks that are uncompensated, that their hourly rate of pay is often less. And the other thing that some of the graphs don't always reflect is that there's a tendency that men are much more effective or more willing to ask for bonuses. With bonuses, because they ask. Often women just seem to be reticent. And I'm getting a message saying my internet is unstable. If I drop out, Neil, please continue. So next slide,
Robin,
please.
this is Eric. What you may want to do is turn your camera off.
Okay, lovely. There we go. Okay, so a reflection here in terms of pay equity. This you can see you've got the euro sign there in terms of pay. So European region, and what is very clear that overall take-home pay is higher for men than for women, and this is certainly true in Australia. It's true in most countries where I've worked. Next slide, please. So when we look at hourly income for male and female associates, what we see here is at no matter which category you look at, whether it is companion animal, whether it's food animal, whether it's equine, on the whole, we're seeing that the overall hourly income for men and for women are different, and usually higher for men. And what's great is that the AVMA has taken time to collect and analyze this data. With the graphs that Neil showed you, there were just still countries where there was no data available, and this remains a problem, that we're not getting gender disaggregated data coming through. It's a problem in terms of understanding what's happening with our profession for animals, who's owning animals, who's making decisions about animals. Often that data about the people with whom we work is also not disaggregated by gender, and that reduces our ability to understand the people that we're working with. Next slide, please. So another gap is simply not paying any attention to gendered health issues. And the first line that I've got there, why gender disaggregators? For me, working with an anthropologist, understanding gender-sensitive methodology was a real revelation, not only because it helped me to understand that within a society there are different perspectives and different backgrounds, different knowledge between men and women, but it also helped me to just understand the society as a whole. So gender is about understanding, men, women, people of other genders, but that same methodology helps you to also understand people within different wealth categories, different ethnic categories. It's a way of coming to understand the communities with whom you're working, and it really does help to improve your ability to work with those communities, because you will understand the different perspectives and priorities of those different groups within your community. And on the bottom right there, I've got some of the different symbols just picked up off the internet. But when we study vet science, we learn about, as Neil mentioned, the genetic determination of sex. Certainly during my training, I understood about that within mammals, and particularly farm animals, understanding the genetic basis of the sex of that animal was quite important, because often, for instance, if you're an XXY or a triple X, it will affect the fertility of that animal. So that's why we do the testing. We want to know that those animals are going to be able to fulfill their function within an economic context, and that's why we study it. It tends to be a bit of a vacuum within public health. It's not often discussed where people but it is certainly a challenge for people whose genetic composition doesn't match being either sort of male or female, and often the fact that these people may go on to be fertile in life, they only discover that when they're in a relationship and are seeking to have children. So this is a tough issue, and one that requires enormous sensitivity as we deal with it. And so in terms of health issues, as mentioned before, women are often performing a lot more work, both within the workplace and at home, so working very long hours, getting less compensation, and as mentioned, getting insufficient or less pay on an hourly basis. But when it comes to issues within the workplace, some of those caring roles of that care for that animal, for that owner, these are things that you don't leave in the workplace, and it comes back to thinking about the mental health of our profession, and how those different approaches can really impact on our own well-being, in addition to say, physical risks associated with the different work that we perform. Next slide, please. I mentioned the term gender-sensitive research. It remains it's a problem both in the way that we collect our data, how we use our data. I think that what's important, talk specifically now about my background working with avian influenza in the early days of the H5N1 outbreak in Southeast Asia. There was insufficient attention given to the impact of gender, and particularly if we look at family poultry, so poultry raised at the household level, often this is the responsibility of women. Women have a lot of the roles, and in some cases, what we were seeing in some countries, women were more likely to die of H5N1 because they were working with the chickens. They were also the ones handling the chicken before it was cooked. So the very sad cases where the woman was preparing the carcass, cooking the chicken, she dies of H5N1, but her husband who ate the cooked chicken did not get infected. So these are roles and impacts of gender and the gender roles within households, within companies that we do need to take account of. However, there are a number of groups that are forming in order the importance of gender. So I'll take the example there on the bottom left, which is Women for One Health. This organization, this network was formed after the World One Health Congress in Singapore a couple of years ago. But the important thing is that it's not a network just for women. So people such as Neil are involved. It's a group that recognize that we're using this gender sensitive approach to ensure that everybody can make a contribution, be they men, be they people from different ethnicities, different geographical settings. So the important thing there is understanding that our research is better, our society is stronger when everyone is able to make a contribution. Next slide, please. For those of us who have been through education and particularly working in countries where access to education can be a challenge at the household level, where households have to make difficult decisions about who's going to be supported to get education, what we see is that it can be more difficult for girls and for women to be able to get access to school, to be supported and to have the time to go to school, and then to continue all the way through to follow their dreams, to be able to achieve their goals in life. This is not new to you. I'm going to go through the next 3 slides a little quickly so that we have time for Neil's points and some Q&A. Next, please. Okay, so if we're going to look at the policy environment, I'll just go through this quite quickly, but it is really important that policies be equitable. Using that term, they're equitable rather than equality, but using equity as the key term. It needs to be based on inclusive approaches so that we've got a great range of stakeholders. Those policies need to be encoded so that it's harder to change them, and to understand that policies are never all good or all bad, and we need to be doing some foresight to try and ensure that the policy we introduce does the while benefiting the most. Next slide, please. When we look at gender, there's a range in terms of policy going all the way from being gender exploitative. So this, an example here would simply be having a project where you know you don't have enough money, so you're going to prioritize a lower cost workforce, and often in cases that may well be women. So that's probably a gender exploitative approach. Next slide, please. And the next one is think a policy that is simply gender blind. but it will always have an impact by choosing not to understand gender, not to do a gender analysis, not to seek different perspectives across the gender spectrum. That is going to, in almost all cases, decrease the quality of the policy, because policies are about organising people, and people are different. Next slide, please. So there's this, if we want to have policies that are gender aware, there's this spectrum about moving from accommodating gender differences, being sensitive to gender difference, and then being transformative. So here I prefer to use the term gender equity, because it's about giving the different groups what they need to achieve those goals, and it's what we need to have improved health codes. Next slide, please. So by becoming gender sensitive, it means that we're aware that there are differences across the groups that we're working with, and that they are a whole range of different factors that will contribute to that. And then the hope is that being gender sensitive is a great start, and it gives you that opportunity to then be gender responsive, and we hope to be gender transformative as our future goal. Next slide, please. So just recapping there, that when we talk about accommodating gender, that's a good start, but it's not the end of the story. Once we have that data of understanding, we need to act with that data. It's just like doing surveillance. Just to do surveillance without an action is a wasted opportunity. Next slide, please. So moving on and just reinforcing that message, that being gender sensitive is a good start. It helps biology. Oops, not sure what's going on there, sorry. But I have a feeling this could be my last slide anyway. So Neil, I think I'm handing over to you now. Is that correct?
Yes, yes. Yeah, sorry, I clicked the wrong button real quick there. But now we're back. So now we're going to talk about just previous experience with gender and infectious disease, mostly in the context of certain pandemics and disease outbreaks. So and you might have heard this already, there's some intermixing of terms, either what we're saying or what sources we're using for both sex and gender. Especially when you need to look at health on a population level, and are not able to sort of get crosstabs, so to speak, in your data for each individual person. You do need to tend to look at things in generalities, and kind of a shorthand that people do for that is by essentially looking at the over 99% overlap that you have, at least in some countries, with biological males identifying as men and biological females identifying as women, and then sort of say that for most people, or realize that for most people, you can combine, or rather expect that a significant majority of those with these biological realities are also going to be facing these, sociocultural realities as well. And this is something that you'll see when we look at some of these actual biological phenomena, those being of infectious disease. So this is just the immune response differences and immunological differences, I should say, generally between females and males. Generally speaking, females have a much more robust immune response than males, and this becomes readily apparent when you look at, in some circumstances, morbidity and mortality figures for certain infectious diseases. And you can see that there's very few things that males will generally have a more robust response with. And this is just that looking at infectious diseases. But now we're going to be getting into some of the sociological dimensions of some of these outbreaks. So with COVID-19, though, this is sort of the same case as far as those biological realities. Specifically, when we're looking at pandemics, we see women in roles of being caretakers, and that's the biggest thing that is why you see in many pandemics the rates of morbidity and mortality for women to, generally speaking, be higher. Certainly this has been true for a lot of emerging infectious diseases that have popped up in the past decade or two. And you see them taking on caretaker roles, particularly within the community. If there's someone who needs to be taking care of family members or other members of their village or what have you, that will very often fall on women, and that generalizes very broadly across the world as well. And certainly in regions where we most expect there to be emerging pandemic threats. Women are also generally tasked with at least taking care of livestock. There can be a kind of complex, definitely depending on the specific culture, interplay between who is doing the caretaking and who has sort of the economic power. Typically, it will be women doing the caretaking and men having the overall kind of economic ownership and say of the livestock in addition to other forms of property. But because of that caretaking action, those biological and potential disease interactions between women and domestic animals can tend to be greater than that of men in some settings. And certainly this is also the case for professional caretakers, for professional healthcare workers. The rate of, just as in veterinary medicine, the rate of women in human medicine is been rising drastically across the globe. I believe student populations for medical students hit 50-50 in the US, I think about 5 years ago at this point in time. And that's certainly some of the Baltic states, as well as some Slavic countries. Women's empowerment has been actually quite profound relative to other places, and you can see that is the case here as well. And just you can see the pictures here. Our veterinarians being included in all of this. And I am completely blanking on her name right now, but that is that sort of a black and white picture is the first woman graduate from the Royal Veterinary College. Robin, maybe you remember that better than I do.
I don't, I'm sorry.
Oh.
But I
If
do
anyone
know
Googles
that
it-
ours was Dr. Olivia.
Gotcha. If anyone just Googles first woman graduate from Royal Veterinary College, they'll find that name. That's who that person is. One thing that we do see as a increased risk with men in the context of One Health issues, particularly those of emerging infectious diseases, are the role they play with hunting and gathering, and particularly bushmeat. Bushmeat and wildlife in general, I was just giving a talk about this yesterday, is essentially to sum up a lot of things, a substantial or at least noteworthy risk for emerging pandemic threats or novel zoonoses to arise or to spill over into human populations. And indeed, that's what's speculated to have happened around the turn of the 20th century, give or take a couple decades, with HIV. Somewhere in Central Africa, was through the hunting and preparation, maybe a little bit less so the consumption of bush meat in those areas. But even if it's not going to be sort of something that crosses over gastrointestinally, the whole hunting process, either be it via the implements you're using or just tripping and falling or whatever, you're going to have a lot of opportunity for things to get into circulation parenterally as well. So this is just a big threat for zoonotic diseases that more so men bear the burden of in these settings with which we're most concerned. Now we're going to look at a little bit more organizational type fare. We're regarding institutional gender and sex equity research practices. There's been for about a decade now, for a little over a decade now, a global call to action that's been put out, I believe published in some sort of scholarly outlet. And I know that people put out calls to action not infrequently, but this has been a bit more of a rallying flag than you might typically expect. And it's helped instigate a lot of different institutions putting into action plans to collect gender disaggregated data and separate out gender and sex to look differentially at the sociobiological effects of either. And yeah, that's resulted in many different organizations, including the WHO, including any variety of NGOs, to have their own policies and strategies and action plans specifically around the topic of gender and gender empowerment. And this is just the WHO's right here, but you can also find those for Bill and Melinda Gates Foundation, the Global Fund, just all of the heavy hitters, the Wellcome Trust. You'll see them around with a lot of different tools, statements, policies, and resources on gender in general. Those are some of your first go-to things or organizations. One sort of methodology or method via which larger institutions try and forward the cause of gender equity is by having women's or gender committees. And these are just examples that are available from within the veterinary sphere. I know there have been some in the UK that have popped up over the years. I wasn't able to find any graphics for those, but certainly in the United States we have Vivaldi. There's a variety of veterinary colleges that have, or veterinary faculties that have gender committees on them, including both in high income as well as LMIC settings, which was really great to see. And you can see a couple of examples of those there. You can also see a really interesting example of global north-south or south-north partnership with, I don't think it's Utrecht. I think it's some organization in the Netherlands who have helped the University of Rwanda and their College of Veterinary Medicine medicine, biosecurity. It's not just veterinary medicine, but basically their vet institution to develop a gender committee. They've gotten some sort of help basically from some folks in the Netherlands to do that. Many people, including in addition to all those NGOs I just mentioned, a lot of EU-funded projects have helped create tools basically for measuring how you're doing or telling you how to proceed with sort of gender equitable work, and also measure your efficacy and progress in trying to do that. So M&E, and these are just or monitoring evaluation M&E. So that means so you can see just a short snippet basically of some of those right here. This is called Sager, and I believe this is an EU funded thing. A lot of roads lead to the European Commission when it comes to this sort of work. So as far as kind of how we keep pushing forward and keep driving this issue home, I guess, so to speak. One thing that's continually an important thing, and there's a lot of resources to do this as well, including OSMART, that's OH-SMART, stylized all caps, from the University of Minnesota, is telling apart and listing out and knowing the connections between the different stakeholders with relevance to whatever issue you're trying to advance. In this case being women in veterinary public health and One Health. There's some of the bigger players right now. we have the emerging Women for One Health network, of course. We have many other people who Women for One Health have been trying to kind of capitalize on the success of like women in global health, which is been sort of a model for Women for One Health. And then there's other kind of power players that we could go on and list for days, but we can also just skip that for now. That are good to sort of try and get the ear of. And a lot of those would generally include some of those larger NGOs. And a lot of increasing gender capacity looks like just capacity building in general, especially now that we're starting to see gender get so well integrated into the practices and policies and everything basically of some of the larger movers and shakers within global health and public health and veterinary health as well. The sort of gender sensitivity that we see in a lot of veterinary institutions, just like with a lot of things, with veterinary medicine being a little bit of a smaller player in some of those global health settings versus like human health, is that the materials and resources to focus on the essentially like veterinary humanities, as one would medical humanities, has been a little bit smaller. But it is certainly coming along, and an emerging discussion that's being had. Just having this webinar is great evidence of that, and we're definitely really thankful to ACVPM for having this and helping us push that conversation forward. Also putting all this into education, training people from the get-go is really important, and making sure that people understand that gender is a important factor in health, in their job, of course, in life in general, and the ways and dimensions via which it is and the magnitude to which it is. Also very important. And that's something that in a variety of settings, maybe not so much in veterinary schools at this point, in a formalized fashion, certainly informal, with its overall feminization, but via various modalities, that is happening more and more so as time moves forward. This has all been part of this subject matter is very much drawn from a chapter that Robin and myself and various others put together actually for this textbook right here. So if you want to learn more about this, by all means, check it out and see if you are in a position to teach a class or whatever. It's very much geared towards that sort of population. And let me know if you have any questions about that. And also a big thanks to Robin, who this is a very sort of emerging conversation, and who exactly to find to write the chapter was a bit of a question. And Robin played a huge role in gathering a bit of a crew of people who could help do that. So a big thanks to her and all those folks as well. And with that, we'd be happy to take any questions.
We'll now move into questions and answers. We've got a few on here. First one we'll pose to Dr. Alders. She's asked for this question. Any thoughts on how veterinary medicine remains such a trusted profession, but such an underpaid one? Is this related to the feminization of the field and the income disparity between men and women in other professions?
It's an extremely good question to which I can't give you an evidence-based answer. Vets have generally been trusted for a very long time, and as Neil's data showed, initially the majority of vets were men. They were seen as respected members of society and contributing to the economy, contributing to the war effort in the early days. What's happening now, I think, in terms of feminization, I think vets are certainly trusted because we work with animals that are important at the household level. But why it is that we remain trusted but not always well rewarded, that where we really need our social science colleagues. to assist. I'm going to turn my video off. I see I'm unstable. Neil, did you want to respond to that? I like Willie's comment here that we're trusted because we're not well rewarded. That could be that people see us doing work without demanding high rewards. What do you think, Neil?
You cut off for a little bit at the end there, but I think everything that was coming through was pretty much on point. I don't have anything to add to it.
All right. Next question is regarding, I guess, situations, currently the status in the United States, with pushback against programs like Women, Peace, and Security initiatives, diversity, equity, and inclusion programs. Do you see this putting further research into how sex and gender affect professional environment under threat?
I guess I can get that one started at least. Yes. Actually, a huge source for this chapter for at least a lot of the basics that laid out the sort of foundation of sex versus gender in biomedical research and all that. A huge source for that was the NIH, and the website for that, specifically those sources that we cited, have gone down in the past couple of months, and it is kind of troublesome to see that all that progress that was being made is now not as such, I suppose. So we're seeing the global community have to pick up kind of a lot of the slack from that, and I think that they are, but traditionally the U.S. has been such a massive funder of biomedical research, that particularly through the NIH, and making sure we have a more sort of nimble funding infrastructure that's able to accommodate for that is going to be difficult, and indeed it is.
Could I just add to that? I hope you
Absolutely, yeah.
can hear me. Yeah, just to say, not being able to really explore gender dimensions, it's not unique to the US, the situation you have there. There are people in many countries who, for various reasons, are not able to explore this. And so there's it's really important that nobody feel threatened or need to sort of take the high moral ground. When you're writing your proposals, you're very skillful at using language that will hopefully get the funding. You collect your data in a way that will allow you to do analyses that may be published internationally or that can be published, a couple of years down the track. My approach, as it and if mentioned, when working in countries, we're talking about things such as gender, such as sexuality is in some cases a legal issue. I don't talk about the human aspect. I talk about what we know from science done with animals with whom we work and with whom we're qualified to speak. So I simply present, for instance, just start the conversation by looking at the different sex chromosome combinations within animals and that spectrum. And I simply ask the question, is this spectrum seen in humans? And that's where I end the discussion, just to leave people with the thought that there is a spectrum in animals. Is that the case in humans? The answer is yes, but I don't have to give that answer. I'm just presenting my understanding of what the situation is within animals, and the hope that that will facilitate ongoing conversations within those societies. Over.
All right. Seeing no other questions, we will go ahead and close out today. I definitely want to thank Dr. Vizot and Alders for a very timely, thought-provoking, and likely ever-evolving topic or discussion on this topic today. Thanks everybody for attending. I'm going to turn it over to Dr. Stephen Castle, our chair of the Continuing Education Committee, for any final comments.
Thanks, Dr. Toring. I just want to echo the same, Neil, Robin. Very good presentation. Lots of applause coming up. So just remind everybody that we will not have a webinar for the month of July. Hopefully we'll see you at the AVMA convention. But August, September, October, November, we've got a great lineup that's coming up, including some canine brucellosis, information about aquaculture, and we were able to find a couple of speakers about H5 in wastewater, and then another topic on the pork industry and concerns about health in our swine. So that's going to be the fall lineup. I hope that you'll join us for that. And again, Neil, Robin, thanks again for a great presentation.
Thank you.
Thanks, everyone. Please go well.